And joining us now is NBC News medical contributor Dr. Natalie Azar. She spent the last week working on a COVID floor at NYU Langone Hospital here in Manhattan. Dr. Natalie, let's first talk about that experimental drug. It seems promising. What do you know about it?
Yeah, so last week, towards the end of last week, the New England Journal actually released a report where in their patients who got remdesivir, and by the way, they got a 10-day course as opposed to this patient, they seemed to get maybe half the course. About 2/3 of patients with severe breathing problems improved, and over half of patients were able to get off of their mechanical ventilation. But the problem with this is that there was no control group, so we really can't say, do the patients improve because of the drug, or would they have improved anyway? And especially important is, how long do you give the drug? Who do you give the drug to, and when in their course do you give it? Is it better early? Is it better late? That's why we keep on talking about how important it is to have these placebo-controlled, blinded studies to really be able to tell, is it a drug effect or not? It's certainly good to see this, but nothing definitive.
Interesting article in the Wall Street Journal that talked about the symptoms of COVID-19, how it affects your heart and how it affects your lungs. But something it added to that list was how it affects your brain.
Right. You know what I've said about this disease, Hoda, is that I feel like every few days it throws a new curveball. We find out something new about it. And yeah, it's not unprecedented that a virus could affect the nervous system. But in a JAMA article that was recently released, some of the most common symptoms were headache, dizziness, impaired consciousness, muscle problems, and of course, the loss of taste and smell that, hit the airwaves a couple of weeks ago because we were like, wow, I can't believe this is happening. But some of the more serious side effects that there also, or manifestations, were actually stroke and seizure. So from neurologists, they're saying, listen, if you have a patient who's presenting suddenly with these unusual symptoms, think about COVID. In the beginning, remember, we were saying respiratory. Now we're finding out that certainly it can present in a myriad of different ways.
Yeah, you hear about people hallucinating and things like that. So you did something last week. You went to a hospital. You worked 12-hour shifts. You were right there on the front line. You actually got to see what it's like there up close. What struck you about your time in the hospital?
Oh my God, so many perspectives, Hoda. One of the things I always say from the beginning is that I just have to acknowledge my tour of duty was really short compared to the people who've been doing this from the very beginning. And when I talk about the network and collaboration, I'm talking doctors, nurses, respiratory therapists, radiology techs, the housekeeping, all of these folks who are exposing themselves on a regular basis, I just have the utmost admiration for. One of the things that really hit home to me was just how isolated the patients are. They are in their own rooms. The number of staff who goes in and out is really limited. We're restricted in terms of the number of times we can be at the bedside. And so what I found to be one of the most rewarding experiences was certainly to be able to provide medical care, but I feel like I was giving them something else. And that was just contact with a human, albeit through all of my PPE. But just a little time to give them a feeling of human-to-human contact. And that, for me, was one of the most rewarding parts of my experience, for sure.
It's interesting that doctors and nurses now are not only fulfilling their medical role, they actually have to fulfill the role of a family, because families can't be there. They have to be there with cell phones, holding up FaceTime calls, and just reassuring everyone, right?
Absolutely. There was one patient in particular, every single time I walked into his room, he already had his phone in his hand, and he immediately started dialing one of his friends. There was also a language barrier for some of the patients. And so that was really another challenge. And so every time he saw me walk in, he immediately dialed his friend so that, we could have a conversation, which that just stuck with me, and I would say they're all watching the news about COVID-19, and they're lying in bed with COVID-19. It was all very, very surreal on so many levels.
Something for all of us to keep in mind. Dr. Natalie, thank you for what you did, and thanks for joining us this morning.
Thanks, Hoda.
You make a good point there. Doctors and nurses being called on to do so much more these days.
Yeah, and trying to divide their time. I was listening to a doctor talk about it. He's like, I have to care for other patients, but I need to be here with this person while, they go through this difficult time.
We're asking so much of our doctors and nurses and healthcare workers, and they are rising to the occasion, which is incredible.